Okay, so now we are going to come to the next type of hemolytic anemia. This is called as G6PD deficiency. What is this? G6PD deficiency. Okay, so how many of you know about G6PD deficiency? Is it, do you know about it? Do you don't know about it? Everybody should know about it. You know why? This is very important. We'll discuss why is it important. Okay. Now, first thing you should remember that this G6PD deficiency, so this is a very important disease. Okay, why? Because it is inherited in a X-linked recessive manner. So the inheritance of G6PD deficiency is X-linked recessive. So usually males are affected and females are usually not affected, but females can be affected. It is not that they cannot be affected, they can be, but usually they are less affected than males. Males are predominantly affected. So now what happens in G6PD? Why is G6PD so important to us? Okay, so let me take you back to your chapter 1 of general pathology, okay, where you studied about a very important antioxidant, okay, glutathione peroxidase. And when we talk about this, this is peroxidase. So this peroxidase used to convert peroxide, that is H2O2, into water. So it was a very powerful antioxidant producing enzyme because it used to convert the H2O2 into water. So very powerful molecule. Now, when you look at glutathione peroxidase, in the process of doing this, it used to do one more thing. You know what? This H2O2 was reduced to the water, but in this process, it also used to change reduced glutathione, okay, okay, which is also denoted by GSH, to oxidized glutathione, okay. So it was changing the reduced glutathione into oxidized glutathione, which is also called as GSSG, okay. So oxidized glutathione. Now this oxidized glutathione has to be again changed into reduced glutathione, isn't it? And this is done by a molecule called as glutathione reductase, okay. So this molecule is called as glutathione reductase. But this glutathione reductase cannot work like this. It requires a very important cofactor for its functioning, and this important cofactor is NADPH. So this is a very important cofactor. NADPH is a very important cofactor, and this NADPH is produced by a very important reaction, that is glucose 6-phosphate is changed into 6-phosphogluconate with the help of NADPH, which is a very strong, which is a very important cofactor for changing the reduced glutathione to the oxidized glutathione, okay. So now you understood the importance of this molecule. It's very important. If suppose we have, okay, so this is done by an enzyme here, glucose 6-phosphate dehydrogenase, okay. So suppose we have a deficiency of this enzyme here, okay, glucose 6-phosphate dehydrogenase enzyme is not there. Suppose we don't have this enzyme, okay. So let's see, now we're going to see a catastrophic event. So now there is no G6PD enzyme, okay. So when there is no G6PD, there will be no NADPH, correct. No NADPH means that glutathione peroxidase will not be able to work. So these free radical, H2O2 is a free radical, will act, okay, and it will cause free radical injury, okay. It will cause free radical injury of the cells. It will cause free radical injury to the cells. Please, everybody should remember, the only way of removing free radicals of RBC is this pathway. So red blood cells can remove their free radicals only through this pathway. If this pathway is defective, red cells are not able to remove their free radicals, and that is so crucial, okay. You understood this? So if there is deficiency of G6PD, free radical injury increases in the red cells. Now let us see what will these free radicals do. So this, you know, normally if when we talk about hemoglobin has sulfhydryl groups. So hemoglobin has sulfhydryl groups, okay. So I'm going to draw this red cell for you. Okay, so this is the red cell. Okay, let's say, yes, so this is the red cell. We have the red cell, and red cell has hemoglobin, and hemoglobin has sulfhydryl groups, isn't it? So let's go inside like this. Okay, okay, so hemoglobin has sulfhydryl groups. So if there is increase in the free radicals, these sulfhydryl groups are going to get joined. These sulfhydryl groups will join with each other. Okay, they will join with each other, and because of this binding, this hemoglobin will become denatured. Hemoglobin will become denatured. So there is cross linking of the sulfhydryl groups because of free radicals, and this hemoglobin will become denatured. So this denatured hemoglobin will attach to the membranes of the red cell like this. Okay, and this denatured hemoglobin, okay, is called as Haems bodies. Okay, Haems bodies. So these are called Haems bodies, but these Haems bodies are not seen with the naked smear. Neither you can see them on Romanowski stain. So this is denatured hemoglobin, which has occurred due to cross-linking of sulfhydryl groups, which occurred because there was increased free radicals. So these Haems bodies are only visible on supravital stains. Supravital stains are the only ones which help you see the live things. So supravital stain like new methylene blue, brilliant crescile blue, crystal violet, azure B, these will help you see in Haems bodies. So then you can see the Haems bodies attached to the periphery of the red cells, okay, on supravital stain. Now let us see. So now two things can happen now. So now, one, it might be that the number of Haems bodies are very much in the cell. So there is lot of oxidant stress, okay, and there are lots of Haems bodies which are formed. So these much Haems bodies, denatured hemoglobin in the red cells are not able to bear it, and they will break down in the circulation itself. So this produces intravascular hemolysis. What does this produces? Intravascular hemolysis, and this patient presents with hemoglobinuria, hemosideриnuria. Why hemosideриnuria? You tell me. Because the hemoglobin which is passed in the kidney is resorbed by the proximal convoluted tubule, which changes the iron in the hemoglobin to hemosiderin, and after the life of PCT is over, these hemosiderin loaded cells are released in circulation. So these patients will present with hemoglobinuria and hemosideриnuria. Okay, so when the amount of Haems bodies is high. But majority of the times the number of Haems bodies are not very high, and they will escape lysis in the circulation, but they cannot escape the master. Who is the master? Spleen. Spleen will say, very good, come, very nice. So these are Haems bodies containing cell, let me catch them. So now spleen will identify them, and as soon as they go into spleen, two things will happen again. So what are the two things that will happen here now? So first, spleen will identify lots of Haems bodies on the cell, and it will try to remove them. And when it tries to remove these Haems bodies, it removes the surface area also. It removes the membrane of the cell also. You already know, if the membrane of the cell is removed, surface area to volume ratio will be decreased, and the cells will become spherocytes. So what will come out from the spleen will be spherocytes whose membranes are removed. So you will see spherocytes here. That's one thing that will happen. The second thing that will happen is much more interesting. So what will happen here? So now there are Haems body. Let's say this is it. Okay, so there is a Haems body on the membrane of the cell here. So what will spleen do is, spleen will cuddle all the hemoglobin towards the opposite end. Okay, it will cuddle all the hemoglobin to the opposite end like this. So you will see that half of the cell is vacant. Okay, there is no hemoglobin, so that it is preventing the denaturation of the hemoglobin. It moves all the hemoglobin away from the point where there are Haems bodies, and this cell will appear half vacant like this. Okay, so it will appear as somebody has bitten these cells, but actually it is not bitten. It is actually nothing but a coagulum of hemoglobin which is moved away from the margin where there are Haems bodies, and these cells are called bite cells. So these cells will come out in the peripheral blood, and they are called as bite cells. So what do you see? Okay, so what do you see in cases of G6PD deficiency? So one, either you can see intravascular hemolysis itself, or you can see extravascular hemolysis. And when you see extravascular hemolysis, you are able to see two types of cell. One is bite cell and the other are spherocytes. So remember, G6PD deficiency is also a very important cause of spherocytosis. It's also a very important cause of spherocytosis, which you should remember. Is everybody clear with the mechanism of G6PD deficiency? Okay. Now let's come to little higher. Okay, so these are bites. So if somebody says which all cells will you see in G6PD deficiency, you will see Haems bodies, which can be seen in supravital stain, and you can see bite cells. Okay, so once you're clear, let's see these cells first, and then we'll go to the more topic. Okay, so now let's look at these cells. Okay, so when you look at these cells here, first thing, okay, let's look at this cell here. So first thing that catches your eye here, okay, let's see, first thing that catches your eye here in this picture. So can you see these red cells? So these red cells have this vacant center here, so vacant end here like this. Okay, because half the hemoglobin is moved towards the opposite end. Okay, so this cell is actually called as, this is how a bite cell will appear. Okay, so the half cell is clear, so this is bite cell. These are also called as hemighost cells, so they can also be called as hemighost cells. Okay, so half of the end is vacant, and half is full with hemoglobin. So these are called hemighost cells. Okay, but if you do a supravital stain, on the supravital stain, you will see that the margins contain these bodies, and these bodies are nothing but Haems bodies. Okay, why this is not a reticulocyte? Reticulocyte is usually seen as a coagulum, it's usually seen as a reticulum inside the cell. So this is just present in the margins, so has to be Haems bodies. Is everybody clear on the peripheral smear? What are you going to see? So these are the two things you're going to see on this. Now let's come to the important points that we should know about it. Okay, now, so let's know about the variants of the G6PD. Okay, so we have lot of variants of the G6PD, which everybody should know. You know, these variants are divided according to their electrophoretic mobility most of the times. So most normal variant, okay, normal variant, or which is also known as wild variant, okay, wild type. So wild always means natural. Okay, so not natural G6PD variant is G6PDB. So this has normal enzyme activity. It has normal enzyme activity. Normal enzyme activity. It's a wild variant. It has a normal enzyme activity. Now next we come to A plus. Okay. So now A plus means it has more mobility. It has more mobility than, on electrophoresis, it has more mobility than B. It has more mobility than B. Again, here the enzyme activity is again normal. Normal enzyme activity, and it only has more mobility. Next variant is A negative. Okay, A negative has only 5 to 15% enzyme activity. Okay, so it usually has 5 to 15 enzyme activity than the normal counterpart, and usually it is present in African Americans. It usually has decreased stability. Okay, so its stability is less. It has less stability. Okay, next variant is the most important one, Mediterranean variant. Okay, Mediterranean variant. Okay, this Mediterranean variant is the most common symptomatic variant. This is because their enzyme activity is less than 1%. The enzyme activity is very, very less. So how do you remember? See, do you remember in the school we used to get report cards? Okay, so when we used to get report cards, we used to say A plus and B grade, okay. Okay, so A plus and B were considered okay. So they had normal enzyme activity. But once negative sign comes, that is very bad. So A negative means, oh, marks are less, 5 to 15%. And the worst one, who is this worst? So whenever they used to write special comments, performed very poorly like that, then it was considered very bad. So when they write Mediterranean, that means very poor, you're very poor, okay, less than 1%, okay, enzyme activity, that means it's very poor. Okay, so this is symptomatic variant and the enzyme activity is less than 1%.